put a telfa right up against the wound, which is a non-stick bandage. And we're just going to put a little bit of Iodide ointment on there, right up against the wound. And then we've got some sterile gauze. We're going to use the gauze just to put a little bit of pressure on the leg. We don't want to pull super tight with it, but we do want it snug enough to try to keep the bandage in place. And we can kind of come a little bit kind of down below the fetlock to kind of cup it in around there. And I normally kind of pull tight across the front of the leg as opposed to behind the leg where the tendons are. So we can put a little bit more pressure on the front part of it. Then the next layer we're going to use is the combine wrap to put a little bit more compression on there to help with swelling. And again, same thing. We just don't want a whole lot of wrinkles in there, so try to keep it smooth. And I'm going to start at the top here with the gauze. So this gauze can put a little bit more compression on the leg to help out with swelling. And again, we can pull across the front and then just kind of lay it across the back. And just try to keep it nice and smooth without any big wrinkles or anything on there. Again, can kind of like cup it across the back of the fetlock. Try to keep it a little snugger across there. You normally end up with just a little bit of the white from the cotton underneath showing at the top and bottom, so that the gauze doesn't get too tight up against the skin. Okay. Then we'll put some vet wrap on. Same thing with it, trying to just make sure we don't have any big wrinkles or anything. We may not need this big cotton. We may not need to continue that for the next few days. And so we may just kind of do the layers that were underneath, that kind of non-stick and the gauze. And then we can do the vet wrap on top of that. Normally just make sure that it's good and snug. Elastic on around the top and bottom just to seal it off. Keep any dirt or debris from getting in there. And this layer we really just want to set on there. We don't want to pull it too tight or anything. Stretch this out a little bit so that it's easier to put on the leg. about half on the horse and half on the bandage. And not pulling tight with this at all, just setting it on there. Kind of just a swipe or two across there. And then just make sure that we're good and snug across there.